Hey guys, welcome to the Consult Before the Cut, your go-to podcast for all things anti-aging, aesthetics, and plastic surgery. I'm one of your hosts, Dr. Jonathan Weiler, board-certified plastic surgeon, been in practice for over 15 years, founder of Weiler Plastic Surgery Group and the Rejuvime Medical Clinics. And my co-host here today, we are missing Britt, but my other co-host here today is Taylor
Besh, physician's assistant with Weiler Plastic Surgery. Excited today to
expert injector
to share all the exciting stuff about a great topic I'm super passionate about.
Yes, this is so. Today we always like to bring in experts, and today Taylor is functioning as one of our experts, and we will bring in one of our lovely other injectors, one of our other physician extenders, and then nurse practitioner. Been with us for years. She's going to be a patient representative and
expert. She loves it as much as I do.
It's going to be a wonderful conversation. And I am going to am not the expert in this by any means. I certainly did this. Actually, I
introduced you to
this. I introduced this. This has been around for a long time. So I actually introduced Taylor to this type of injectable, but I have now backed off injectables. I don't do them anymore. So I do not consider myself an injectable expert anymore. I'm a casual. Matter of fact, Taylor does all my wife's injectables, even me. So, all right. So I'm going to talk about a little bit. So today we're talking about the overall market of injectables, right? But we're really focusing down into a new type of injectables, which would classify more as a biostimulatory.
That's right.
Classification, right?
That's right.
So explain, Taylor, the two. So when people say, injectables, kind of break it down for simple people in terms of simple terms. I like to think of there's Botox, right, or neuromodulators, which isn't really considered injectables, but it's a needle thing, right? And then there's fillers injectables, and then there's the biostimulatory
That's
stuff.
right. So neuromodulators address muscle.
Right.
We'll talk about that later, different day.
But the class name is Botox, right?
That's right.
So not
Botox,
talking about that.
Not today. Well, the other two things that we're going to kind of focus down on, one is a biostimulatory filler, and the other is hyaluronic acid filler.
Right.
There is a shift in the aesthetic industry moving more towards biostimulatory fillers.
Correct.
Biostimulatory fillers is a vague term, but we're really honing down on Sculptra today.
The OG.
Biostimulatory fillers versus hyaluronic acid fillers. Hyaluronic acid filler, think of it as a gel that's immediately replacing volume in volume depleted areas.
And explain, why do we have to restore or replace volume? Explain to the audience.
So good question. I think over the years, this is getting better, but a long time ago, we used to have a terrible thought of fillers being used maybe improperly, which sometimes they were. But as we age, we naturally lose collagen, elastin, bone, fat, in the trend of losing fat. So natural aging.
And our skin. So I always say, look, think of your face as it's covered with skin.
That's
then you got fat, muscle, bone, right? It's like a tablecloth.
That's right.
Right? But our table is constantly shrinking.
Yep.
And our tablecloth is getting looser.
The tablecloth is getting looser, hence the skin. I love that analogy. Yeah. So there's different ways to address that. To address the volume loss, bone loss, that's where hyaluronic acid biostimulatory fillers come in. The skin, we have numerous lasers, chemical peels, things like that.
Even fillers into the skin now.
That's right. Skin hydrators, such as Skin Vive. Yep. But today we're focusing on, number one, the difference between HA filler and biostimulants. So HA, think of it as an instant gel volume placed into the skin to replace the volume. Biostimulants, making a huge impression on the aesthetic industry currently, is allowing your body to produce its own natural collagen and elastin.
Okay.
So it is not an instant gratification thing. It's not an instant fill like hyaluronic acid is. But Sculptra is really, really on an up-and-coming part of the practice or part of the industry, because in the world of aesthetics, we're moving more towards less crazy-looking, overfilled appearance, more of a natural look. And that's right where the biostimulatory fillers fit in.
So for the audience that's not, let's say experts or have had fillers done before, talk to us about the process of a filler. And when we say the word filler, it can be an HA, which is hyaluronic acid, or it can be a biostimulatory, which one of them is Sculptra. So talk to me about a patient comes in, let's say, let's use our typical patient, which is 44 years old, 46 years old. They've had 2 to 4 children, right? They're middle income, and they look and feel like they've aged tremendously.
Yeah. So and it makes perfect sense because we stop producing collagen in our 30s. We start really losing it at 40. So you said 44. That's is the perfect age group where we are seeing tons of patients just wanting to feel better about themselves, and it makes sense. They're losing their collagen. So come in for a complimentary consultation, and we just make a good game plan. I want to understand what their needs are, what is bothering them, and also what I see. And I always ask, do you mind if I tell you what I see? And majority of the times they say yes. And then we talk about primarily volume loss.
Right.
So either way, like you said, HA or biostimulants, if we proceed with filler that day, we go through the whole spiel of before care, after care. No dental work, no immunizations, 2 weeks before, 2 weeks after, no makeup the day of, low key the day of. Numb the face for about 20 minutes, either one. Do the injections, and they're out of there in probably 40 minutes. Little bit of downtime day of, but nothing crazy. And so that's why it kind of fits into our world right now is the convenience, the ease of the recovery, and obviously the results that it yields.
The results are amazing.
Yeah.
Now, what makes you, and we're focusing on Sculptra specifically today, what makes you tell a patient, I think you would benefit from Sculptra?
Okay, that's a really good question. And in the beginning, it was a little hard to move from.
Well, this is something that's been around for a long time, Sculptra. Let's.
Okay, so you want to go back to the beginning. So
go back to our beginning.
What is Sculptra?
Yeah.
Sculptra is PLLA, poly-L-lactic acid. So PLLA was in our sutures in the 1960s. So long time ago. It's been around a very, very long time ago.
Correct.
It was brought into the medicinal realm for HIV patients who had extreme volume loss in their face in 2004.
Mostly in the temporal
and malar wasting.
Right.
But specifically those two areas. So then they continue, from 2004 to 2009, injecting these HIV patients, changing their lives.
Correct.
And then later on started to become more prominent, FDA approved for a cosmetic indication.
Correct.
That was in 2009 where it kind of came into the U.S. cosmetically, but then Galderma purchased Sculptra in 2014, and that's where it's really, really changed.
But we were doing Sculptra in 2009. When I first started, we had a few patients, and we were probably not doing it the way it's being done or explaining the way it's being done.
Right.
And I was a little frustrated with it back in the day.
So that's exactly right. We stopped doing it for probably 7 years. There since have been indications that have changed on how to mix the product and the ease of injection and not the safety or efficacy because that has always been there, but the actual ease has changed tremendously in the last, I would say, 4 years.
And that's also given us much better results.
That's right.
We're more. There's been a lot more information studied about it and indications for use, and we understand it better. Right. And so that's what Sculptra is. And remember, Sculptra is a brand name of one of the biostimulators out there. It's an OG, I call it.
That's right.
Something that we use all the time in our clinics, in our practices, and something we love. And so take me back to the original question. Somebody comes in and they're your prototypical patient. And obviously I'm not in the rooms with you all day long, but tell me when do you say, and I call it the Taylor touch, when do you grab their hand or grab their face like you always do and say, you need Sculptra? When does that happen?
So Sculptra is the perfect adjunct to those patients who have just pan-facial aging. Not that they have a little bit of volume loss here or a little bit of a nasolabial fold. That is more of a full facial rejuvenation. They want to feel better about themselves. They want an overall a better youthful appearance, but not in a specific spot, I would say.
So is this a younger patient than the 40s? Is this an older patient? Is this a thin patient?
Love it. Okay.
Is this
Good question.
a workout fanatic patient? What is this?
It used to be, I would say, pretty much everybody who would metabolize HA filler, which would be a marathon runner, or I would do Sculptra over HA. Through the years, though, it is a prejuvenation for patients in their 20s. They do about a vial a year. And then it gets more aggressively treated the older that they get. So I used to say it was more of a specific demographic or a specific person who needed it. Somebody who would blow through filler and somebody who had a huge high metabolism. Now it is honestly the whole realm of my patient demographic. Really? So prejuvenation for 20s to 30s. And then at 40, we really, really need to start honing in on doing a complete series and then maintaining every year after that. I have patients who do not want a facelift in their 60s, 65. We're doing Sculptra in combination with HA filler to get their expectations, and it's working.
Wow.
Absolutely.
See, you're actually educating me. I was not even aware of the prejuvenation in the younger ages. And I actually think this would probably be a great time. We've got another injector here who's going to join us because I always say it's essential to have faith in your injector, and you're an awesome injector. But everybody, you can always use the baking analogy. You can have a wonderful tasting cake and beautiful, but everybody bakes it a little bit differently. So HAs versus Sculptra versus the biostimulatory stuff. It's like baking. A lot of different ways to do it, right? And so we're going to kind of really dial down on your techniques. We're going to bring Lauren in, dial down on her techniques and her indications. And she's experienced it and what she thinks about it.
We really wanted Lauren Mickenheim to come on today because she's passionate about it, and she's also experienced the results from Sculptra. So she can kind of be the expert and the patient and give us a little feedback.
So we're going to break away here. When we come back, we're going to bring Lauren Mickenheim in to have a little discussion.
From Botox to tummy tucks, we provide patients with real confidence. Weiler Plastic Surgery. Something real.
I wanted to lose weight, and Rejuvime Medical made it easy. I did lab work and then a one-on-one consultation where we talked about goals and a treatment plan, and I started losing weight within a few weeks and was down 30 pounds in 3 months. The nurses and the medical providers made me feel comfortable, and I'm the most comfortable I have ever been in years. My name is Parker Ramirez, and I want to tell everyone I know to change their life and to get started now. Rejuvime Medical is the best option because they'll be at your side the entire way.
All right, guys, welcome to the Consult Before the Cut, your go-to podcast, right? And we're back, and I'd like to thank our sponsors, Rejuvime Medical, the age-defying clinic, and Weiler Plastic Surgery Group. Both of these clinics are all throughout South Louisiana. Rejuvime Medical specializes in anti-aging, hormone replacement, GLP-1s, and of course, the Weiler Plastic Surgery Group has 5 wonderful surgeons, over 10 injectors. We've got 2 of the wonderful injectors here, multiple estheticians in multiple locations. So look us up on the web and come in for your services. And Taylor, we've got somebody joining us today, right? Sitting in between us.
Yes, we'd love to introduce Lauren Mickenheim. She's a nurse practitioner that has been in the Baton Rouge metro area with us for
almost 7 years.
7 years.
Wow. Time flies, huh?
Yes.
7 years. So she was brought in today. She loves Sculptra. She's received Sculptra. She does Sculptra on a lot of her patients. So just want to dive deeper with her and give her experience as well.
And before we do that, Taylor at our break was getting very scientific, and I want you to explain the principle behind Sculptra, right?
So it is a little bit, nitty gritty, but Sculptra is PLLA, poly-L-lactic acid.
Right.
So like we talked about, it's been around for years and years. It actually comes from fermented beets. I think in Europe. Bizarre.
It started in Europe. Yep.
So the PLLA, what happens is we're going to go through with Lauren how you mix the product, but it is injected into a layer of skin that causes macrophages to basically attack the PLLA. And so think of that as like Pac-Man coming in to try to eat up.
Inflammatory response.
Yes.
Right?
The inflammatory response recruits the macrophages to come and basically eat up the PLLA. Through that process, fibroblasts are formed. Fibroblasts are then stimulating, regenerating collagen and elastin. That is the key to anti-aging. That is the good stuff. So to try to understand it more, it is a very, very scientific process that works. The inflammatory process in that layer of skin is literally perfection. So once that happens, lactic acid is formed. It converts to water and CO2 and is absorbed. So the PLLA is absorbed. The collagen and elastin is what stays behind, and that is really what is the chef's kiss to the skin.
And there's some recent data that shows it may stimulate a little bit of adipose growth too, which is interesting. So that's coming out now too, right? I was reading an article, 27% increase in adipose thickness or growth. And we can use it in the rear, we can use it up in the face. Yeah. And so that's another thing that is.
So another recent study.
Adipose is fat, right? So
yes, adipose is fat cells.
We're getting a little
technical, which is good
here.
In the face, right? But they did a punch biopsy of where after a Sculptra treatment session, so it was 4 different vials, 4 different sessions were injected, and they did the same biopsy after it was treated, and there were 100 genes that were dormant in the skin prior were then active. So it shows it is working, and it is working aggressively. So it's good.
Yes.
So let's take it back to obviously what is the process. We kind of talked about that, but you have a patient who is here. He asked me, I'm going to ask you, who's your perfect Sculptra patient?
Yeah. Or do you have a range? Do you have lots of different categories?
I do have a range, but I would say the person who I start on Sculptra comes in aging, starting to get mid-face volume loss, nasolabial folds, and they want to have a little more volume increase in their face, but they don't want anybody to know. That, to me, is key.
Subtle but significant.
Right. They want results. They don't want to leave the office and everybody say, oh, she had cheek filler, she had, chin filler. So what I do is I suggest Sculptra. So I don't know if we want to get into so what I say is 1 vial a decade. If they're in their 30s, I'll say we'll do 2 vials today. You'll come back 6 weeks later. We'll do another vial. I'll see where you're at. With Sculptra, you won't see the results. So I guess we could kind of get into okay. So the day you get injected for 3 to 5 days, your face is full. You have.
Why is that? How do you mix Sculptra?
Right.
Sculptra is mixed with sterile water and a little lidocaine. That helps with just the comfort of the injections. So your face is full of that sterile water. So you look amazing. I say
great volume right off the bat.
Yes.
Right. I mean, they love it.
Wow.
I'm like, this is what you're gonna look like eventually. I'm like,
then
this
a week
is it.
later,
Right. Your body absorbs that water.
Yep.
Then around 6 weeks, 2 months, that's what I say, you're going to start seeing the results of that Sculptra. That's when I want to see you again for that next treatment.
For that second round. So 6 weeks to 8 weeks.
6 to 8 weeks is when I see. And that's when you'll start seeing the results anyway. So you can be sitting in the chair and I can say, are you liking it? Yes, they love it. And then we'll do your second session. And if you need, I say up to 6 vials, we'll do 2, 6 weeks later 2, and then another 2.
So 20 years old is 2 vials. 60 years old is 6 vials plus,
that's
right?
Correct.
And you're doing these 6 to 8 weeks in between. So Taylor was talking about sort of the preemptive patients in their 20s that are using this are doing 2 vials every year, right? Or 2 vials every, is that correct? It
lasts 2 years, but I say yearly, you maintain it.
And some of our ladies, let's say our prototypical patients, 40s, is using 4 vials every 2 years or every year. Is that correct?
That's right.
Okay.
Initially. They are not going to need 4 vials every single year, but the first year.
To build that foundation.
That's right. Yeah. Because you will continue to lose collagen. And I think that she uses the same analogy. So Sculptra is like fertilizing a flower bed, right? So you're planting seeds. The collagen is going to start to grow. But then those flowers die off with age, time, life. So then you're refertilizing. So it's a constant cycle of the growth of the collagen. Correct. So let's get back to, okay, so a patient's coming in. You are seeing them initially. They want to be treated that day. It is a 50-year-old patient, and they have nasolabial folds, mid-face volume loss, a little bit of jowling that they're starting. So you decide Sculptra. You're going to numb their face.
We numb 15, 20 minutes. I leave the room, reconstitute the Sculptra.
Which can be instantly reconstituted
so
now.
That's mixing, reconstitutes mixing.
Oh, yes.
Mixing.
Back in the day, I had to mix it.
Back in the day, we had to mix it 48
hours
before.
It's crazy.
It would clog.
Yep.
The needle would clog probably 20 times while injecting.
Changing needles, you'd be handing me
Change
needles.
the needle.
A lot easier now.
Yes, so they have
Yeah.
really, Galderma has done a great job with the new reconstitution. So you step out, reconstitute the product, go back in, cleanse the skin, do the injections. Would you say that it is more or less painful than HA?
I think Sculptra is more comfortable. I think it's more water-based. I think there is lidocaine in both, I will say that. But I use cannula a lot with the Sculptra, and so I feel like that helps with less bruising, swelling. I feel like people, I'd say tend to say Sculptra.
Let's look at you from a patient perspective. Where did Sculptra come into your
journey?
Your journey, yeah.
I am 41, so I have had HA filler in my cheeks, my lips, but I felt like I globally was seeing aging, and that's what Sculptra does. We always say if you put it temples, in front of the ear, along the jawline, these marionettes, and as it builds your collagen, it pulls the skin back, globally refills you. That's what I wanted.
So I'm going to ask a question because I'm going to act naive on this. Where do you guys inject Sculptra when you're injecting? Is it different at different ages? Is it different with different sort of goals? Does that sort of make sense?
I would say it's different per patient. Every single patient is treated differently.
Okay.
The areas that I see the most benefit from Sculptra would be the temporal hollowing. If extreme temporal hollowing, though, you will need a HA filler to give you that
so like
projection.
our marathon runners are very thin ladies.
Yes. Right. So absolutely. Temporal hollowing. Cheek, but that can also be HA filler. So it's a little different. Pre-auricular is huge.
Right.
Huge. There's a lot of volume loss here. Submalar here. Amazing results. Here. That is the lifting capacity. So when you thicken that tissue and you can pull back here, it addresses everything here.
Right.
Also piriform.
Right around the nose.
Chin shadowing. Jowling here along the jawline. But I would say your home run is that preauricular submalar space for the lift and the pullback.
Is that, Lauren, something?
Yes.
Same areas?
Same areas. Some women don't need any in their temples, and I'll do it a lot. These smile lines right here, that drives. I don't like putting direct filler in there. I just don't. I don't think it is a natural look when they're smiling and talking. So I do a lot of Sculptra right there into that submalar marionette area.
Jawline, too?
Jawline. Pretty much everybody gets that preauricular area just because I feel like that pulls their skin back there, kind of lifts that nasolabial fold. I do some of the nasolabial fold. But yeah, I think it's per patient when they walk in and where their volume deficit is.
How many vials have you had injected into your face?
I've had 4, so I did.
And you're 41, so that makes
sense.
Okay.
Following your rules.
And then every January, my plan is to do 2 vials. So you can do 1 to 2. Okay, so they say prevention and correction is when you do the 1 vial per decade. So I did 4 for that. Then for my prevention only, I will do 2 vials a year. So every January, that's my plan. And that's kind of what I get all my patients on. We get that first series done, and then once a year, they'll come in for that continued prevention.
Right. What is your post-operative care for your patients?
Okay, so after you get your injections, I clean you off. I tell you no working out, no makeup. And the biggie is the massage. So you massage your areas that I injected your face 5 times a day, 5 minutes each time for 5 days.
5, 5, 5.
5, 5, 5. Is it a vigorous massage? It is a light massage? Is it?
Okay, so the most important one is the first one, which is what we do as
So you
providers.
guys are
I would
giving
say
them-
it's more vigorous
Yeah, it's a
than
little
like a
vigorous.
little fluff
Yes.
massage.
I get at it, yeah. You want to get that collagen to be stimulated. That's what I just tell them. Kind of gives them that extra little like motivation.
And I kind of don't instill fear by any means, but I'm serious about the massage. And I say, if you're not going to massage your face, you're going to have an overproduction of collagen in one spot,
Right.
and you will be able to palpate that
Nodule, right.
PLA, that nodule underneath the skin. So to prevent that, the only way to prevent it is to massage. And they'll massage if you tell them that, because
Right.
they understand it completely, you know?
Let me ask you this, guys, who's not a candidate for Sculptra?
Good question. There are contraindications.
A few contraindications if you have an active autoimmune flare-up at the time.
Not a disease, but a flare-up, right?
You
So
can get
lots
it
of
if you
people
have
a
an
disease,
right, but only if you're in a flare-up. If it's under control, you're fine.
Right.
You're a candidate. An allergy to beets, Taylor.
Beets, there goes the beets again. That's strange, but yes.
Pregnant, breastfeeding, of course, and a history of keloid formations. I know we hadn't really talked on that, but we have been told
Keloid or
to.
hypertrophic scarring.
Is that because you're penetrating the skin, or is that underneath the skin? Do you
Okay,
know?
so I think it's a debated topic because I was telling you about those biopsies that they have
Yeah.
done, and it shows no scar tissue formation.
Yeah.
In the past, we have thought that there was some scar tissue formation in the deeper levels,
Right.
hence preventing doing it because of the possibility of forming a keloid or hypertrophic scar.
Sure.
There has been no recent research of any type of scar tissue formation from Sculptra.
Okay.
So I think that's a little bit of a debated topic of recent. That was long ago. Whenever we did it a very long time ago, that was one of the concerns. I would say that's a little bit of a debate currently.
Okay.
One thing I would ask you, whenever you are doing a facelift, can you tell if a patient has Sculptra? I know you can with Kybella or deoxycholic acid
Yeah,
in the
little bit.
submental, but can you tell if a patient has been
You
treated?
may come across some nodularities or some little areas of, I'm not going to call it scar tissues, but you know, a little bit more firmness, but nothing. I wouldn't call it scar tissue. I think as surgeons we get a little particular
Yeah.
and like to blame other things. I mean, I did a revisionary facelift yesterday on an African American lady that was tough, and there was a lot of scar tissue, obviously, because it was surgery. But you know, I have never come across excessive issues or scarring in a situation from previous injectables.
Yeah.
To be honest with you,
Yeah.
now the Kybella, yes, but in you know, and nothing crazy with Kybella, just differences.
Yeah.
But not with filler. I don't find that to be a problem. Some surgeons rant and rave about it. I do a lot of facelifts, and I don't have any problem with
Yeah.
it.
Okay.
I don't have any problem.
One thing I wouldn't say is a contraindication, but it is a conversation. Patients who want instant gratification.
Yes.
Patients who have a wedding next weekend or
Right.
a
Yeah,
month from
that's
now,
right.
and they
Right.
need to be at their
Right.
best.
or first time patients.
True.
You know, I don't know if
Absolutely.
it's the best thing.
Yeah,
Right?
if they have to be informed of the process and they have to be on board with the process,
Right.
because it is a little annoying coming to see us every 8 weeks for 3 consecutive times.
is.
It's worth it.
Yes.
But non-compliance, patients who don't, you know, there is a conversation
Yeah.
to be had. So moving away from the face, I want to jump to a whole different topic. Body with Sculptra, with PLLA. Tell me your experience. Is it possible? Where can you treat? What do you treat?
My experience, I have done the buttocks of a lady. She came in, she was realistic about the expectations because once again, it does take a lot of vials. I think I did 6 vials. I think, honestly, I mean, it can be anywhere from 10 to 20 vials.
Right.
So,
Depending on what you want and how much volume
exactly.
you need. Right.
So she was very happy.
Right.
Once again, you have to realize it's going to take a few months to see it. It's going to probably take a couple of treatments.
Right.
Right.
Also, you can treat knees. There's
Yep.
multiple areas that you can also treat with Sculptra.
Arms, chest, anywhere where there is laxity that that collagen can benefit the skin, which is
Yes.
pretty much anywhere.
Yes. Yeah.
You can place Sculptra.
Yeah, no, I think as we've, a lot of this, it was a wonderful invention, let's say back in, I think, '05, right, or '04. And we've just learned so much about
Absolutely.
it. And I think it's wonderful in the body for a thin woman as she ages. You lose, and there's always areas of the body where the crepiness of the skin or the skin just doesn't have the elasticity, the belly, the thighs, the knees, the arms, the butt, you lose your rear as you get older too. So, I think we're becoming more aware of these fillers or biostimulators in all areas of the body, which is awesome.
Absolutely.
Which is awesome.
Yes.
Biostimulants in combination with hyaluronic acid and neuromodulators are the wave of the future for injectables.
Oh, awesome. I mean, we're getting into the age, when me and Taylor first got into the business, I know you've been into it for a while too, we were sort of at the cusp of, neuromodulators, Botox. They just had a few HAs on the market, right? Sculptra was just coming on board. And, now, at Rejuvime, we do the GLP-1s, which is Ozempics and tirzepatides. We are in this, golden era of fighting the aging process. And not from a surgical perspective, right? From a medicine perspective, right? Whether it be injectables, whether it be better managing our weight, whether it be hormone replacements. I mean, we're kind of in this golden age. I think it's awesome. And I think, like he said, I'm not saying this, and we're still using breast implants, but that may not be here in 10 years, right?
Absolutely.
You may come in and we may have, and some of this is done in Europe, and I don't recommend it, putting massive quantities, but there are things out there that are trying to fill the breast to adequate. Like you said, on the rear end, you can do in the rear end. You've got to use, and when we say a lot, we're talking, 10 vials, right?
Absolutely.
But, there's some people in Hollywood and that got a ton of money, and they're putting in 50, 60 vials, right, over a series of a few months.
Absolutely.
To get that sort of, and Madonna, I don't know if you guys have looked at Madonna. Madonna's one of those ladies that, she actually was one of the original Sculptra patients back in the day. And because it started in Europe, it's a long story. Probably overdone with Sculptra.
I was about to say, I don't want to use her as an
use
example.
her. But, and so it can be abused. But,
the future of the aesthetic world, there are studies currently going on overseas. In 2026, the United States should have the gold standard of a product, which is going to be a HA biostimulant mix. So you're getting the instant gratification and the true collagen stimulation. We should have that in 2 years, and that is going to be game
changer. I mean, part of the I think part of the problem and part of the benefit is that this industry changes so quickly, right? And so stuff comes out every single week, just about. I mean, not literally, but what you say, whether it's a device for skin tightening, whether it's a surgical thing, right? And the problem is there's so much stuff coming out that you don't know what's legit and what's not legit, right? And I think y'all's job, especially, because you guys, especially are the ones that are seeing these patients on a fairly regular basis, like your protocol, you're bringing these ladies in, you tell them, I want to see you yearly, right? At the minimum, right? And that's not even talking about their neuromodulators.
Correct.
But, hey, I need to meet your goals, I need to see you on a yearly basis to just discuss the fillers, right? The biostimulatory stuff. So y'all the ones are the gatekeepers to these ladies and these men also.
Yeah, I was about to say.
I think you guys have such a large role to play in this process, and really to guide these people to what's correct, right? And give them. And
once you develop that trust, they're on board.
I know both of you ladies have patients that Taylor works a few more days than Lauren. Lauren's hard to get into too. Y'all both ladies have a packed schedule, but y'all have a very committed following amongst your patients that are committed. They travel from hours away. Some of these ladies. I know you do a little bit of traveling to meet some of your patients more down in South Louisiana. But you guys are the gatekeepers. And so information like this is essential. Anything you want to add, Lauren, that I know you have a few
One
little
last
notes.
little thing. I do think a lot of women are moving towards more of regenerative medicine, less filler in the face. So that's why I love Sculptra. I think it's kind of like the future what people are starting to walk in the door and ask for.
Right.
So,
natural enhancement.
Well, yeah, I mean, we realize the aging process is so many things going on. You just can't do one thing and look normal, right? You look a little crazy, right?
Yeah.
And so, HAs have their place, biostimulators have their place, neuromodulators has their place, devices, Ellacor, there's devices out there that have their place. Surgery still has its place.
Absolutely.
And it's really sort of a team. And as this business evolves, I know it sounds, I'm putting plastic surgeons, we're not necessarily the gatekeepers anymore. The primary gatekeepers in this industry or in the aesthetic world is becoming your physician extender, whether it's an NP or PA. Y'all are developing these long-term relationships with these patients. You guys are seeing them because as a surgeon, I'm so busy operating and doing these higher end, more invasive procedures that I don't have the bandwidth to do a neuromodulator.
And that's a good point because we're going to have conversations, sometimes hard conversations. And if these things cannot meet your needs, we are in the perfect setup. We're an all-encompassing practice. So from a dermaplane to a facelift. Right. Sculptra is not going to meet your need. HA is not going to meet your need. Then we're going to talk about a facelift.
Right. And likewise, I'll see patients end up in my clinic. I'll have a 30-year-old woman come in, tell me she's booked for a facelift consult. I'm like, whoa. Right. I need to walk you over across the clinic, and you need to meet with Lauren or Taylor, and you need to have a more substantial discussion about what's out there beyond they may have seen somebody in the past that said, "Oh, I can't help you." Well, because they didn't have access to everything that we have, and you guys will
or
guide
lack
them.
of comfort. Yes.
Lack of comfort with the injectable, right?
With the product,
the experience with the product.
Yes.
You're absolutely right. So, if a lot of clinics or a lot of people don't have the robust practice that we have, so they just carry one brand, or they don't deal in biostimulatories, or they just do Botox. They don't do injectables. And so it's, and we'll have topics. We got a ton of stuff to cover in the future. They don't do liquid rhinoplasties, right? And so we can cover everything. So it's important.
Sculptra, the wave of the future, biostimulatory filler. I think we kind of hit on tons of different options. Would love to invite any of you guys in for a complimentary consultation just to hear more about it. See before and after pictures. I do want to do some pictures, show some before and afters on the podcast and go from there. So Lauren, thank you so much for coming in.
This is great.
I appreciate it. And thank you. And guys, thank you for watching the consult before the cut. Continue to follow us and see us weekly.